Let me tell you something about myself, and I think it will give you an idea as to what you might experience in either classes that I teach or in the academic advising that we will work on together. I am a public health practice person. Uh, I am involved in the teaching program. There are other faculty that have more of a research orientation who are also involved in the teaching program. I think you'll find that you'll benefit from both kinds of faculty in the classes that you take. I spent most of my career in public health practice outside of academic settings. Before I came to UIC, I was actually at United Way, and I was in charge of the rationale for allocating the funds that come in from donors. And in order to do this, you had to have some skills and knowledge of how you assess needs for a community, how you set priorities, and also some knowledge of resource allocation models. So I was senior vice president there and had a staff that supported the decision makers in how much money to allocate and to whom. Prior to the United Way, I was executive director of an organization that was based at the University of Chicago called the Chicago Health Policy Research Council. This was a fascinating organization in that it was engaged in coming up with a rationale for allocating research dollars in response to the phenomena of Chicago. It was very focused and intentionally focused on Chicago and those research type programs that would inform policymaking. It was an organization that published a quarterly report that monitored changes in healthcare delivery and health status in Chicago, and we were able to use local foundation funding in order to pay faculty researchers at all of the universities in town to do research that was policy relevant and had a good research design. Prior to that, I was the deputy commissioner for the Chicago Department of Public Health. At the time, the nation's third largest local health department. And I managed the entire operation except the administrative programs and the planning programs reported directly to the commissioner. But I had the mental health clinics, the primary care clinics, the public health and prevention services, the Office of AIDS Prevention, and all of the operational entities that tend to be associated with big city public health. Before the health department, I was executive director of a program called Access to Care. It was a suburban-based program that actually supported primary care delivery for people who were medically indigent, people that were above Medicaid eligibility, but did not have private health insurance for a physician office visit. This was a very innovative program and would not have been possible without the support of a local foundation that took a chance on an extraordinarily innovative type program. That program still exists today and is going strong. Prior to Access to Care, I was executive director of the suburban Cook County, DuPage County Health Systems Agency. It was the area-wide or regional planning agency for Cook County, excluding the city of Chicago and DuPage County. This was during a time when the federal government was paying for health planning at the state level and at the regional level. So my career in public health practice and in management goes back a long time. I've been on the planet for quite a while. So I've had these experiences, and we're able to design the classroom experience around some of these things. Right now, I am on the state board that does certificate of need reviews. And these are reviews of capital expenditure proposals by hospitals and long-term care facilities and ambulatory surgery facilities in Illinois. This is a program that most of the states, about 36 states across the country, still have certificate of need, even though it's sort of a holdover from the days when the federal government paid for planning at the state and the regional level. These and other things will come up in your curriculum because it's important for you to understand the U.S. healthcare system and the relationship between that system and community health improvement activities and the health status of the population. And so I wanted you to know that because you should get to know your advisor regardless of whether they're engaged in practice or engaged in research, because it will give you a hint as to the kinds of things that you may want to do with your career once you complete your degree.